Lipedema is a fat distribution disorder that affects an estimated 3 million people in Germany. Patients with the condition complain of painful, increased fat deposits that occur in various parts of the body. In most cases, however, it is mainly the legs that are affected by fat accumulation, whereas the arms are also affected in about 1 in 3 patients. As a result of the disease, those affected have to accept considerable restrictions in their private life, at work and in their leisure time. For this reason, these people ask themselves, how can I treat lipedema? We will get to the bottom of this question in this post and further explain to you how to recognize lipedema. Lipedema, the description. As already mentioned, lipedema is a disease in which a disproportionate increase of fatty tissue takes place on the extremities. This happens uncontrollably and, for example, on the thighs, hips, arms or buttocks. Due to the resulting appearance, the disease is therefore also popularly described as the riding pants phenomenon. The disease can be divided into different stages depending on the progress of the disease depending on how far the disease has progressed. These are the following. Stage 1, the skin surface is still smooth, but the subcutaneous fat is thickened and the fat structure is finely nodular. Stage 2, meanwhile, the skin surface is already uneven and the fat structure continues to be coarse. Stage 3, now the tissue is harder and fat flaps become visible. Stage 4, now lipolymphedema also forms, which describes a transport disorder of the lymphatic vessels. This disorder develops because the lymphatic system can no longer remove the fluid that remains in the tissue due to the constant stress, and the fluid therefore accumulates. As a result, nodular thickenings now appear. Unfortunately, it is not yet clear exactly why lipedema occurs or what the cause is behind the enlarged fat cells. However, since only women are affected by the disease, it is assumed that there is a hormonal change. At the same time, genes favor the disease, because in about 60% of cases other family members are also affected. How to recognize lipedema? Nowadays, unfortunately, there is no examination procedure in which lipedema can be clearly assigned. The diagnosis is only made in the course of a physical examination by a physician. The decisive factors here are the visual diagnosis and the symptoms that correspond to the clinical picture. Accordingly, you can also suspect lipedema based on your appearance and symptoms. In addition to the symptoms, which are evident from the course of the disease, the following signs may also occur. Uneven accumulation of fatty tissue on the extremities, for example on the thigh, lower leg and in the knee region up to the ankle. Symmetrical swellings. Possibly also fat pads on the upper or lower arm, sometimes also on the entire arm. Infections in the skin folds. Soft, knotty skin and typical dents. Tendency to spider veins and bruises. Feelings of heaviness and tension. Pain when touching the affected body parts. If you recognize some of these symptoms in yourself, you may be suffering from lipedema. Above all, however, it is typical for the disease, as already explained, that the fat distribution to the adjacent body areas deviates strongly and so, for example, the feet and hands are never affected. There, the accumulation of fatty tissue often stops abruptly. Treat lipedema. Here's how. In the case of lipedema or lymphedema, complex physical decongestive therapy is the main treatment recommended to reduce complications. Complex physical decongestive therapy includes manual lymphatic drainage, compression therapy, skin care, exercise and self-management. We would now like to introduce these points to you, but also show you other helpful treatment options. Compression therapy and lymphatic drainage. Particularly during sports, but also in everyday life, sufferers should make sure to wear compression stockings or tights. This is because compression supports your muscles, veins and lymphatic system so that your blood can flow toward the heart. At the same time, lymph fluid can be better transported to the lymph nodes. In the long run, you will be able to reduce further complications of the fat distribution disorder. Skin and nail care. Intensive skin care is an important part of the therapy for lipedema sufferers, because the skin is subjected to a great deal of stress, especially due to the constant wearing of compression stockings. At the same time, the removal of nutrients no longer functions properly, causing the skin to become dry and cracked. To do your skin some good, you should therefore regularly apply body lotions that have an increased moisture content. In addition to skin care, nail care is also important. Because even minimally longer nails can cause small wounds or cracks in the very stressed skin. Therefore, pay attention to well-groomed nails that you cut regularly and occasionally search the nails for corners, edges. Exercise therapy. Although excessive sport cannot stop the fat distribution disorder, sport can alleviate the symptoms and thus give those affected a higher quality of life. Sporting activity also prevents further fat deposits from developing. The chance of developing secondary lymphedema in addition to lipedema is also reduced. Accordingly, sport is a good preventive measure in the preliminary stage of lipedema, but also helpful at the same time when the disease is more advanced. When it comes to exercise or sports, full body and endurance training is recommended above all, which is easy on the joints. This includes above all trampolining. Trampolining has the advantage of strengthening all your muscles while bouncing, increasing your fat burning and stimulating your lymphatic flow at the same time. Fascia training. In the case of lipedema, there is often a disturbed lymphatic drainage, which also causes the fascia to stick together, which is part of the connective tissue. Such agglutinated fascia tissue causes additional pain for those affected. With a fascia roller for self-massage, for example, you can loosen the fascia tissue again. Water sports. Sports in the water have the advantage of being easy on your joints and at the same time quite effective in reducing your weight. Because your body weight is reduced to a minimum in the water, you reduce the load. Suitable water sports include aqua cycling, aqua fitness, aqua walking, swimming or water gymnastics. Nordic walking. Fast walking with poles is easy on the joints and exercises all muscle groups, such as the arms and legs, which are often affected by the disease. The sport strengthens the tissues especially in those areas and reduces the complications of lipedema. Exercise with the cross trainer. Instead of going jogging, you should do gentle and effective endurance training on a fitness machine. This exercise trains your legs, arms, abdomen and buttocks, which are particularly stressed by the disease. Alternating pressure training. There are special training devices that work with positive and negative pressure. Your tissue is exposed to a vacuum, which stimulates blood circulation at the same time. This special training is particularly suitable for lipedema. Self-management in lipedema. Appropriate organization in everyday life and a certain degree of self-management is very important for those affected by the disease in order to develop an awareness of the disease and learn self-responsible behavior. This is because the necessary therapy for lipedema is time-consuming, as you have to keep it up throughout your entire life and discipline is therefore required here. To gain such awareness and better cope with the disease in everyday life, you should, for example, attend trainings where you will be explained how the lymphatic system works. It is also important that you can ask any questions about the disease, deal with issues such as appropriate skincare products or even practice self-bandaging to cope with the disease in the long term. With the gained insight and improved understanding of the disease, you can better manage your daily life and improve your quality of life, just as it can lead to improved disease progression. Surgical treatment. With liposuction, also known as lipoplasty, you can reduce the abnormal subcutaneous fat tissue on your arms and legs, for example. For this purpose, the many fat cells are simply and gently suctioned out under general anesthesia, reducing your tissue circumference and storage. Depending on the distribution of fat, up to 8 liters of fat can be removed per operation during one procedure, allowing those affected to regain a self-confident body image. Unfortunately, however, the statutory health insurance companies do not usually cover the procedure, which is why this can be costly depending on the effort involved. 5. If this treatment option appeals to you the most, please consult a specialist. Tips for everyday life. In addition to the treatment options, there are other tips that make the discomfort of lipedema more bearable in everyday life. For this we recommend the following. Wear loose-fitting clothes and flat shoes. Wearing loose-fitting clothes and comfortable, flat shoes will not put additional stress on your tissues. At the same time, it is recommended not to wear tight belts or bras. Change your diet if necessary. Since lipedema is not caused by being overweight, diets or weight loss treatments are of no use. However, as already mentioned, weight reduction has a positive effect on your symptoms, as it can reduce the strain on your body. So, if you suffer from overweight regardless of the disease, you can improve your symptoms with a healthy diet. If you also want to get rid of your forehead wrinkles in 7 days, then be sure to watch the video that we link to you here. If you liked the video, then I would be really happy about a thumbs up. And don't forget to subscribe to this channel and activate the bell so you don't miss any new video.